Hello dear friends, welcome to PharmaGrid. So today we are going to discuss biopharmaceutics and pharmacokinetics related questions. Question number 1. Drug A is a weekly basic drug with a pK of 7.8. If administered orally, at which of the following sites of absorption will the drug be able to readily pass through the membrane? The options are mouth having approximately pH 7, stomach pH of 2.5, duodenum approximately pH is 6.1, then jejunum pH approximately 8 and ileum pH approximately 7. Okay, so in the question, the drug is a weekly basic drug having a pK of 7.8. So in the question they have asked us that from which of the following sites this weekly basic drug will be absorbed. So here the correct answer is option D, that is jejunum, having a pH of approximately 8, because here the drug A is a weekly basic drug having pK of 7.8. It will be predominantly in the non-ionized form in the jejunum having pH of 8. For weak bases, the non-ionized form will permeate through the cell membrane readily. So here the two golden rules to be kept in mind is that rule number 1 is only the unionized drug will be absorbed, whereas the ionized drug will be excreted. And rule number 2 is absorption requires same medium. Same medium in the sense that is acidic drugs will be absorbed in the acidic medium, whereas basic drugs will be absorbed in the basic medium. And for excretion, opposite medium is required. Next question. KR2250 is an investigational cholesterol lowering agent. This agent has a high molecular weight and is extensively bound to albumin. KR2250 will have a dash apparent volume of distribution. So in the question they have asked us about the relationship between the plasma protein binding and the volume of distribution. In the question, the drug has got high molecular weight and has got high plasma protein binding. That is, the drug is extensively bound to albumin. So here the options are high volume of distribution, then low volume of distribution, extremely high, normal. So here the correct answer is option B, that is low. So because of its high molecular weight and high protein binding, this KR2250, which is the investigational agent, will be effectively trapped within the plasma. Plasma means vascular compartment, and will have a low apparent volume of distribution. So what you mean by this apparent volume of distribution? It is the volume that would accommodate all the drug in the body if the concentration throughout was the same as in plasma, presuming that the body behaves as a single homogeneous compartment with volume V into which drug gets uniformly distributed. And the relationship between volume of distribution and plasma protein binding is that if the drug is extensively bound to plasma proteins, which means there will be high plasma concentration of the drug, which means low volume of distribution. Okay, and if the drug is sequestered in tissues, means there will be low plasma concentration of the drug, which means high volume of distribution. Question number 3. A 68-year-old woman is brought to the emergency department for treatment of a myocardial infarction. She is currently taking clopidogrel, which is an antiplatelet agent, and aspirin daily, as well as omeprazole. Omeprazole is a proton pump inhibitor and a potent cytochrome inhibitor. And this omeprazole, the particular patient is taking for heartburn. Which of the following is the most likely contributor to her myocardial infarction today? The options are reduced antiplatelet activity of clopidogrel due to aspirin, then reduced antiplatelet activity of clopidogrel due to omeprazole, hypersensitivity reaction due to clopidogrel, increased antiplatelet activity of clopidogrel due to omeprazole, increased antiplatelet activity of clopidogrel due to aspirin. So here the correct answer is option B, that is there will be reduced antiplatelet activity of clopidogrel due to omeprazole. The reason is that clopidogrel is a prodrug, okay, and this clopidogrel requires CYP2C19 activity for conversion to an active metabolite. Because omeprazole is a potent cytochrome, that is CYP2C19 inhibitor, clopidogrel cannot get converted to its active metabolite, and therefore the antiplatelet activity is reduced, potentially contributing to myocardial infarction. Question number 4. Which of the following reactions represents phase 2 of drug metabolism? The options are amidation, hydrolysis, oxidation, reduction, sulfation. So here the correct answer is option E, that is sulfation. So these phase 2 reactions are also known as synthetic or conjugation reactions. So in this phase 2 reactions, there will be coupling between the drug and an endogenous hydrophilic substrate such as glucuronic acid, sulfuric acid, etc. to create more polar conjugate. Thus, Conjugation enhances drug hydrophilicity, and these phase 2 reactions include glucuronide conjugation, glycine conjugation, glutathione conjugation, sulfate conjugation, methylation, and acetylation. So these phase 2 metabolic reactions involve conjugation reactions to make phase 1 metabolites more polar. Sulfation and glucuronidation are the most common phase 2 conjugation reactions. Next question, which statement best describes bioavailability? The options are relation between the physical and the chemical properties of a drug and its systemic absorption, measurement of the rate and amount of therapeutically active drug that reaches the systemic circulation, movement of the drug into body tissues over time, dissolution of the drug in the gastrointestinal tract, and the amount of drug destroyed by the liver before systemic absorption from the gastrointestinal tract occurs. Here the correct answer is option B, that is bioavailability is the measurement of the rate and amount of therapeutically active drug that reaches the systemic circulation. So this bioavailability is the measurement of the rate and extent. Extent means amount of therapeutically active drug that reaches the systemic circulation. The relation of the physical and the chemical properties of a drug to its systemic absorption, that is bioavailability, is known as its biopharmaceutics. The movement of a drug into body tissues is an aspect of pharmacokinetics, which is the study of drug movement in the body over time. The dissolution of a drug in the gastrointestinal tract is a physicochemical process that affects bioavailability. Significant destruction of a drug by the liver before it is systemically absorbed, it is known as the first pass effect because it occurs during the first passage of drug through the liver. This first pass effect decreases bioavailability. The route of drug administration that gives the most rapid onset of the pharmacologic effect is, the options are intramuscular injection, intravenous injection, intradermal injection, peroral administration, and subcutaneous injection. Here the correct answer is option B, that is intravenous injection. When the active form of the drug is given intravenously, it enters the systemic circulation directly. So the drug is delivered rapidly to all tissues including the drug receptor sites. For all other routes of drug administration except intra-arterial injection, the drug must be systemically absorbed before it is distributed to the drug receptor sites. For this reason, the onset of pharmacologic effects is slower to all other options, okay, except this intravenous and intra-arterial injections. After peroral administration, drugs generally are absorbed best from the options are buccal cavity, stomach, duodenum, ileum, rectum. Here the correct answer is option C, that is duodenum. Drugs given orally are well absorbed from the duodenum. The duodenum has a large surface area because of the presence of villi and microvilli. In addition, because the duodenum is well perfused by the mesenteric blood vessels, a concentration gradient is maintained between the lumen of the duodenum and the blood. Question number 8. The characteristics of an active transport process include all of the following except for which one? Okay, so in the question, they have asked us about the wrong statement regarding the active transport. So the options are active transport moves drug molecules against a concentration gradient. Second option, active transport follows fixed law of diffusion. Next option is active transport is a carrier mediated transport system. Active transport requires energy. Active transport of drug molecules may be saturated at a high drug concentrations. So here the wrong statement, or here the correct answer is option B. Okay, so that means the active transport follows fixed law of diffusion, which is the wrong statement. Fixed law of diffusion describes passive diffusion of drug molecules moving from higher concentration to a lower concentration. This process is not saturable and does not require energy. Remaining all other statements are right, or remaining all other statements are correct regarding this active transport process. The passage of drug molecules from a region of high drug concentration to a region of low drug concentration is known as. The options are active transport, bioavailability, biopharmaceutics, simple diffusion, pinocytosis. Here the correct answer is option D, that is simple diffusion. The transport of a drug across a cell membrane by passive diffusion follows fixed law of diffusion. The drug moves with a concentration gradient. Concentration gradient in the sense from an area of high concentration to an area of lower concentration. In contrast, drugs that are actively transported move against a concentration gradient. Question number 10. Which equation describes the rate of drug dissolution from a tablet? The options are Fick's law, Henderson-Hasselbalch equation, law of mass action, Michaelis-Menten equation, Noyes-Whitney equation. So here the correct answer is option A, that is Noyes-Whitney equation. The Noyes-Whitney equation describes the rate at which a solid drug dissolves. Fick's law is similar to the Noyes-Whitney equation in that both equation describes drug movement caused by a concentration gradient. And this Fick's law generally refers to passive diffusion or passive transport of drugs. The law of mass action describes the rate of a chemical reaction. The Michaelis-Menten equation involves enzyme kinetics, and the Henderson-Hasselbalch equation gives the pH of a buffer solution.